Hi everyone, it's AZ Nurse for You. It's been quite a while since I have made any videos. Had some serious complications. A week after surgery, I was supposed to go in to see my surgeon for a follow-up on the day that I ended up going to the emergency room instead. And I have what they call a factor 2 blood clotting disorder. I don't know if I had mentioned that in my previous videos at all. I knew I had it, and I told my surgeon that I had it, and I was on Lovenox injections prophylactically the day of surgery and for a week after. Well, the Monday, about a week later, whenever I was able to start the pudding, I ate a pudding that afternoon, and I just started feeling really crampy from that point on. Didn't sleep well that night, woke up the next morning, felt even worse, and it pretty much was really uncomfortable. And I called my surgeon and asked him, told him what was going on, and he said to just go to the ER. And it wasn't the pudding that I ate. I started developing massive blood clots all in my abdomen and my vena cava, and was in the ER probably by 3 o'clock in the afternoon, and by 10:30 at night they were doing emergency surgery on me. And they went in to go get the blood clots first, and the vascular surgeon put in a IVC filter in my vena cava, and my blood pressure wasn't getting any better. It was down to 50/32 just before they put me under. And during the whole time, I was hearing, I was a nurse, I was hearing my blood pressure, my heart rate was up to 160. I knew I was not in a good situation, but never once did I ever think that I had death cross my mind or dying. I just knew that I was not in a good situation. So anyways, after they put the IVC filter in, and I'll post all kinds of pictures for those that want to see it, there's some pretty gruesome ones. My blood pressure wasn't getting any better, so that's when they decided to go in and cut me open. They cut me open just underneath the top of my rib cage, down to just above my belly button, and found out that I had been bleeding internally because my spleen had ruptured. The blood was getting into the spleen, but there was a blood clot on the exit of the spleen, and it just burst. So during this emergency surgery, they pumped in 6 units of packed red blood cells into me, took my spleen out. I have a picture of that as well. After they took it out, the doctor was nice enough to send it to me via text message, because one of the other doctors took it after they removed it. And had to clean out my abdomen of all the blood and everything, and it was pretty scary because before they went and took me into emergency surgery, they told my family out in the waiting room it didn't look like I was going to make it. They didn't even give me a 20% chance, so that's pretty scary. And after the fact, hearing my family members talk about what the doctor said to them, and hearing what other family members heard, like my mom had told the surgeon before going in to take care of her baby girl. It's pretty hard. So through all this, that's what hurts me the most, is the pain that my family went through with all this. But anyways, I'm alive and I'm kicking, and I'm laying in bed right now because I was really tired today, and I thought, well, maybe I'll make a video so I don't look that great, but whatever, I'm alive. So basically, August 14th was the night of my surgery. I guess I was in surgery until 1 o'clock in the morning of some sort, and then they kept me in a drug-induced coma for a few days afterwards. And it was pretty scary to see a picture of myself while I was in that coma, with tube down my nose, the ventilator in my mouth, and all these IV pumps and IV bags right next to me. Even as a nurse, just looking at that and knowing that that was me. And I don't remember most of that, luckily, but What was interesting is in high school I played basketball and there's some deaf girls on our team, so I'd learned a little bit of sign language with the alphabets and a few little other things. But while I was in the coma, I guess I was able to still hear people around me talking, and my daughter was there at my bedside, of course, and I started sign languaging alphabets and trying to communicate, even though I was in this drug-induced coma, and she said it made sense what I was trying to say. She actually had to go and get a reference of what alphabets were what, and she would write out what I would say, and so that was pretty interesting. So yeah, I was in the hospital for about 2.5 weeks, in ICU for a good week, probably a little bit more, and then I was on the step-down unit for about a week, and then they discharged me home. I got home August 31st, so I was in the hospital when my baby girl turned 17, which was sad. But we did have a birthday party for her that Saturday after I got home. Just had some family here at the house. And had a PICC line in and had I can't even think. I was getting my nutrition through I'm sorry, I'm a nurse and I can't even remember the name of this. TPN, that's what it is. So I was having TPN for my nutrition when I got home from the hospital. It would run 12 hours a day, start it in the evening and run it through the night. And then I was on extended release morphine. I was in a lot of pain, and I had a lot of dry heaves. I was just constantly just dry heaving, and it was horrible. And then being a stubborn patient and nurse, I got to where I stopped wanting to take the TPN, and was able to start eating a little bit more, trying to eat things, and I could keep it down, but I would still dry heave. So then I wanted to get off the morphine, and that was hard because the morphine helped with the pain, but going to Percocet or Vicodin after that, it didn't help the pain as much. But I thought I was having a lot of this dry heaving was because of the pain meds. So eventually got off all that and had issues with my wound. Ended up having, like I said, I'll show you pictures. I had a little, the top part of the incision always gave me problems. As soon as I got home from the hospital, one morning I woke up with my pajamas all wet because of serosanguinous drainage started coming from the top, oozing from the top of the incision. And then shortly thereafter, in the middle of the incision, developed like a whitehead looking type thing, and I put my gloves on and got some gauze and kind of squeezed on it, and just all this nasty, light greenish smelly fluid started just pouring out of my wound. And had my son take me to the emergency room. In the ER, my surgeon's nurse practitioner was there, and he cut open, used lidocaine, numbed it up a bit, but although the first cut he did with the scalpel, I felt, cut it open to clean it out and debride it, and then I did stay overnight in the hospital one night after that, and had my husband, even though I know I'm a nurse and I can know how to do wound care dressings, I didn't want to do it to myself, and it was pretty deep and it was gross and just felt weird, so I stayed in the hospital so that they could train my husband how to do dressing changes to it, because the doctor wanted it done 3 times a day. And then got home with that, ended up getting a home health nurse coming in to help with some of the wound care dressing changes, and had a wound vac in it for a short time, and then it just still was not healing right. So the top of the incision that was initially giving me problems healed up, but then it developed like a whitehead blister again. So went into the doctor's office. His other partner, doctor, surgeon, numbed me up with some lidocaine, cut it open, cleaned it out, and so then I had these two holes, the top of the incision and the middle of the incision, and there was just tunneling underneath. There was just this gunky fluid that would, every time you do the dressing changes, it would be filled up with fluid. And so finally the surgeon said, look, let's just take you back in, do surgery, put me under, and then he was going to cut it open and totally clean it out.